Good afternoon. Fellow Kenyans, once again, welcome to our daily briefing on the status of coronavirus in the country. As I've always stated, this fight against coronavirus requires us to pull together and to collaborate in any manner that we can to enhance our efforts. The government has had a lot of partners in this fight, continues to have partners who are joining us. Various individuals and organizations of goodwill are working with us in our COVID response. I'm happy to note that this cooperation has been very encouraging. Today, the Ministry of Health, in partnership with the Nation Media Group and Jay's Pyrotechnics, will be celebrating our frontline workers and giving encouragement to Kenyans. This partnership entails the use of laser mapping to beam messages of hope, gratitude, and encouragement on the facade of Afia House. This will run for a period of 4 nights, beginning tonight. I want to take this opportunity to thank the Nation Media Group and J Pyrotechnics for this support and for undertaking this noble initiative with the Ministry of Health at no cost to the government, and giving thanks and gratitude to our frontline workers. Fellow Kenyans, we have observed in most urban centers that life has come back to almost normal. I think you will all agree that over the last couple of weeks, we have seen the traffic increase in Nairobi and I suppose in other metropolitan areas. And I think it does worry us that we are coming back and thinking that we are in a state of normalcy. We are not. For example, here in Nairobi, you will find the malls and supermarkets are fully packed. We are still combating this disease. We have not yet registered victory against this disease. I think it would be foolhardy for us to relax and think that we are winning this disease, lower our guard, would be a very dangerous thing for us. We had said that we need to observe social distancing, we need to observe physical distancing, we need to exercise appropriate hygiene, hand washing, and we need to wear masks. But importantly, we need to stay at home if we really do not have to come into the city and towns. That seems not to be working with us as Kenyans now. We're seeing more and more Kenyans coming back into the metropolitan areas. Considering that we are still fighting this disease, this behavior, as I said, is dangerous and can very easily reverse the gains that we have achieved. And I want to caution the management of facilities such as the supermarkets, malls, and others that are not adhering to the measures that we put in place in terms of distancing and the number of people who can enter such facilities at any one time. These facilities face the risk of closure if they fail to abide by the guidelines of the government. Yesterday, I updated you on our coronavirus analysis and reminded you of COVID-19 containment measures targeting the estates of Eastleigh in Nairobi, Old Town in Mombasa, and other counties where movement has been restricted. We will continue to appeal to residents of these areas to observe the outlined measures to help in restoring normalcy. Please keep within those restricted areas and observe all the measures that we have put in place. We also want to thank those residents who continue to abide by these measures. We appreciate the action they are taking, and we want to encourage others to do the same so that we can be able to make gains against this pandemic and move towards the path of normalcy within the shortest time that we can. In order to accelerate the flattening of our curve, we are today introducing additional measures to contain the spread of the virus in the designated areas. These areas I am talking about are the two estates of Isli and Old Town, where we had imposed the restricted movements in and out of these estates. These include prohibition of hawking, street hawking, and any form of hawking within Isli and Old Town in Mombasa. Prohibition of gatherings of whatever nature, and continued closure of malls, markets, restaurants, and eateries in these two closed-off areas. Fellow Kenyans, we have observed that since we issued specific guidelines on reopening of eateries and restaurants, some of the facilities have complied to our protocols, while others have not. I am therefore warning against non-compliance and state action that shall be taken against those who fail to follow the protocols provided by the government. We have elaborated on the protocols and procedures that need to be followed in order to reopen an eatery or a restaurant. These protocols, guidelines, and procedures are available on the Ministry of Health website, and they guide on what needs to be done to get your facilities opened. We have noted that a number of establishments, while complying perhaps with physical distancing requirements, may not have fully complied with the testing requirement of those employees within those facilities. All the requirements must be complied with. The facility must be inspected by a public health officer before you can go back into business. So we are cautioning those who have hastily reopened without complying with all of the requirements, and our officers will be going around to inspect these facilities. Those that do not comply will face the full action of the law. As pertains to our COVID-19 situation, over the last 24 hours, we have tested 1,611 samples. Of these, 28 have tested positive for COVID-19 disease. These 28 are broken down as follows. 24 of these are Kenyans, and 4 are foreigners from Tanzania. This now brings the number of those who have tested positive in the country to 649. The overall number of samples that have been tested in the country so far stands at 31,041. The positive cases are distributed in the counties as follows: 10 in Mombasa, 9 in Nairobi, 4 in Migori, 2 in Kajiado, and 1 each in Machakos, Kiambu, and Homa Bay. It does concern us that we are beginning to see the numbers within some of these border counties of ours, like Migori and Kajiado, slowly rising. And it's a matter of concern, and this is where I think the issue of being able to test the truckers coming in becomes very important. All the 28 positive cases were picked by our surveillance teams. The cases are spread in the following estates in Nairobi: 3 from Embakasi, 2 in Eastleigh, and 1 each from Kayole, Huruma, South B, and Kawangware. The 10 cases in Mombasa are 4 from Vita, 4 from Nyali, and 2 from Likoni. The others are distributed as follows: Migori, 4, Kajiado, 2, and 1 each in Homa Bay, Kiambu, and Machakos. In terms of age, the cases range between 11 years for the youngest and 81 years of age for the oldest. By gender, 17 are males, while 11 are females. I'm happy to note we have registered 5 additional recoveries. This brings the number of recoveries to 207. Unfortunately, we lost 1 more patient to this disease in Mombasa, bringing the number of those that have succumbed to the disease to 30. I want to take this opportunity to express our heartfelt condolences for the family of the deceased, to the family of the deceased. The positive cases show that the virus is beginning to establish itself firmly within our communities. And in order to stop the cycle of transmission, I'm appealing to Kenyans to present themselves for testing and to observe the containment measures as advised by the ministry. To repeat again, these measures include regular hand washing, social distancing, proper wearing of masks, avoiding gatherings, and staying at home unless it is necessary or essential for you to be out of your home. Staying at home is one of the safest things you can do. Further, we note with a lot of concern the continuous identification of new cases in the border counties, in particular Migori and Kajiado. I've already alluded to that. We call upon the management of these counties to ensure that surveillance and screening procedures are adhered to in line with laid down protocols. In addition, the Ministry of Health will work very closely with these border counties and partners to support them in responding to this COVID pandemic, particularly in terms of being able to build capacity to be able to test for the virus at these points. Additionally, the ministry is working with partners and has sent a health support team to Mandera to conduct targeted testing of identified hotspots. So far, a total of 241 samples have been collected from these hotspots in Mandera and have been flown back to Nairobi for analysis. In due time, we should be able to be reporting the results of this analysis. Further, in responding to the increasing demand for testing by truck drivers, the Ministry of Health, in collaboration with County Government of Kajiado, is working on setting up a testing facility at the Namanga border point. On a different matter, let me take this opportunity to inform you that tomorrow, the 10th of May of 2020, is Lupus Awareness Day. This day is celebrated globally to raise awareness about lupus and to honor all those battling this disease. Lupus is a chronic autoimmune disease whereby the body's immune system becomes hyperactive and attacks normal healthy tissues. I want to wish all lupus warriors well as they combat this disease, and to inform them that the Ministry of Health is working on a program to promote community awareness of the disease, even as researchers continue to look for a cure. Thank you.
Thank you very much, Mheshimiwa Waziri. Now it is your